Tonight, one Valley doctor is making a passionate plea for patients who are suffering from long-term conditions, including cancer, to come in for treatment. She worries more lives could be lost because of a fear to seek medical help during the pandemic. I spoke with the medical director of radiation oncology at Desert Regional's Comprehensive Cancer Center, Dr. Judy Jackson. Dr. Jackson, I'd like to go in depth with you on what you're seeing right now. I know that there's something you're very passionate about.
Yes, it's the fact that we're not getting patients in. They're not coming in for testing. They're not coming in to follow up on their cancer checkups. They're not showing up for mammograms and chest X-rays and chest CTs. And also we're diagnosing people far more advanced than we ever saw in the past. I mean, we're talking 20, 25 years ago. That's what we're starting to see. People staying home with their cancer because of a fear of COVID.
How big of a problem is this? Are people really that scared of COVID versus something far more serious potentially?
You know, last year we started noticing a trend, maybe let's say September, a year ago around this time, but it has significantly got worse. I guess as we see wave after wave of COVID come through, we are seeing that fear, and that fear is captivating. We are truly seeing people showing up with such advanced stages, bone destruction, spread of disease that we've never seen, and also that hurts our ability to cure these people. These people would have normally come in, we would have seen them at an earlier stage, and we would have treated them right away. They would have had a wonderful outcome. They've been on and back with their lives again. Now we're seeing people with very advanced cancers. And unfortunately, they go, oh, well, medicine is wonderful now. We can do so much. But that's when we diagnosed people early. That's when we saw those numbers. Now we're seeing people much more advanced. And it's not just breast, it's lung, it's colon, rectal cancers, head and neck cancers across the board, all of them. And not only my specialty, also we've seen it with heart attacks and strokes.
So this fear of COVID is literally killing people.
True. And my biggest comeback is cancer never waits for COVID.
Yeah.
It's
So
not going to wait. It's going to keep growing.
what do you say to people then to get them to come in and to not be so afraid?
I don't know yet. I've called, I have begged, my patients can probably tell you that. I have begged them to come in because not one patient has caught COVID in our cancer center or coming into our facilities or even to doctors' offices. Everyone's ramped up all the cleaning. This is on an hourly basis at least. What we're seeing though are people who are still so afraid, even vaccinated patients, they don't want to come in.
That was going to
And
be my next question. Is the vaccine helping at all? Because now, a lot of people feel a little bit more comfortable, but
Well, it's got to help because it's got to drop our number of seeing more and more variants, more and more waves of COVID. That's the only way we're going to stop this. But unfortunately, there's still that fear. There's that fear that someone's heard about somebody who had this horrible reaction, even though they had a vaccine. But we're doctors. Please let us take care of you. Let us do the job that we were here intended to do. But now we've got so much sorrow because I'm not just watching, people die of COVID. I'm watching them die of their cancers, and I shouldn't have to. Not like this.
Such a powerful message. Dr. Jackson, before I let you go, anything else you would like to share?
It has to stop. People have to come in. You've got to trust the establishment that we have. Things are clean, things are sterilized. You are not going to contact this, but you and your health and your family's health is too important. You've got to come in. Please come in. Don't just sit home and feel it and wonder. Call your doctor, come in, be seen, get the test done. Let us take care of you.
All right. Well, we certainly appreciate your time. Dr. Jackson, thanks so much for joining us.
Thank you.